I want to cover a lot of lecture lah for today. Okay, so good morning everyone. Okay, this is we have covered system. Okay, I covered the central nervous system, also the peripheral nervous system. So today and hopefully tomorrow and Friday we will cover another three important system, which is the cardiovascular, urinary, and also the respiratory lah. Okay, today we will actually mata gatal lah, sabuk ni. Okay, so today we will cover on the cardiovascular system lah. Okay, drugs affecting the cardiovascular system before we you know lah, at the end of the lecture, students should be able to identify drugs that acts on the cardiovascular and also the urinary system, to describe the mechanisms of drug actions on animals, and to explain the indications for the use of the drugs and its positive and adverse effects on the aforementioned drugs. Okay, this is the learning outcome from this lecture. So before we go to the drugs, we have to actually go back refresh lah on the basic anatomy and physiology of the cardiovascular system. Okay, you guys learn on this during which physiology? Second physiology kan? Cardiovascular.
Yes.
Second physiology. So still fresh lah. Second physiology pun baru, 6 months ago kan. So you still guys can refresh lah. Okay, the function actually to transport lah transport delivery of oxygen, nutrients, and also hormones to the various part of the body. Okay, also transport waste products to the appropriate waste system lah. Okay, for example, if it goes to the lungs, it's actually it transports the carbon dioxide, goes to the kidney, it can transport all this urea and everything, and other waste material. If it goes to the intestines, what kind of waste removal lah. Okay, that's the function of the cardiovascular system. Okay, still can remember this. Ni apa lah? What is this? This is the topographical anatomy of the heart lah. Okay, you still can remember which one is the left ventricle, left atrium, right atrium, right ventricle, all those things lah. Quite important lah to know lah where is the locations, anatomical locations, the structure and everything lah, the physiology of the heart. I'm not going to go deep on it because you already learned this on during the anatomy and physiology class lah. Okay. So, the electrical impulse of the heart is originated from the sinoatrial nodes. Okay. So, heart rate is actually primarily controlled by the stimulations of the nervous system. Okay. The parasympathetic and also the sympathetic lah. Okay. So, you guys actually remember lah from the previous lecture that we had on the parasympathetic and also the sympathetic nervous system. Okay. So, workload of the heart is divided into preload and also the afterload. I think this one already been covered by the Prof. Go lah for the previous lectures lah on physiology. Okay, so what is actually today is actually the drugs lah, affecting the physiological functions of the heart lah. Okay, before that, the cardiovascular study lah, on animals okay, it's not as extensive lah as the one they are actually studying in humans. Okay, but most of the models that are being used to actually study the heart, drugs that affect the heart. Okay, what is the current technology in cardiac surgery? They are using the animal models lah. Okay, I remember during my student time we used to have surgeons from University Kebangsaan Malaysia, UKM, they are HUKM, they actually did a year study using dogs in the faculty, dogs from the yard lah, to study the heart transplant so they don't study it on humans because it's study, right? It's something to do for research. So the best actually model to study the cardiovascular system is actually the study on dog, canine, because the similarities is quite it's quite the similarity is quite high between the heart of the dog and also heart of human. So they are studying the cardiovascular system using the animalologist, the canine lah. Okay, and also I think the most common ataupun the most important study on cardiovascular normally is for animals so far is actually the study of the equine cardiovascular system because heart in the horse is actually the the most unique and also the most strongest set of muscles in horse. Okay, that's why a lot of study on equine cardiovascular is quite extensive these days because one of the other things is actually to determine whether the use of some drugs, whether it's permitted or not permitted lah. Okay, because a lot of drugs is actually can be used to increase the capacity of the heart. So it's actually considered as cheating lah because for example, if you got the horse is used for racing and also for endurance, they actually give an extra edge, extra advantage to the horse. And also, by the way, and it's actually unfortunately they will actually cause some welfare issues lah to the horse lah. Okay, because there are actually some cases where they use a lot of drugs, for example, like steroids, to push the capacity of the heart, the horse. It then will actually cause the heart sometimes to actually rupture, the muscle rupture, actually the horse will actually die of bleeding, hemorrhagic shock, and it's because of shock, hypovolemic shock. Okay, that's why they tend to see whether study is actually very quite extensive in horse, okay, rather than. Do you know there is this horse? Have you heard of a racing horse somewhere in the US? Actually, a winning horse. So it's horse is quite small, but actually he won the Triple Crown. The Triple Crown. There's a Kentucky Derby. What else? The other two. When they actually cut open the horse after they actually the biggest muscles in that. It's like maybe 25-30% larger than an average horse lah. That's why they keep on winning races lah. Okay, so bear in mind, that's why if later on if you are actually interested to do any studies, okay, maybe it goes for some subspecialty. In veterinary, we don't have such specialty. We have, but we need to actually go for the same thing. Go for veterinary residency to get a specialty. So one of the one of the field that is actually lacking is actually the study on the cardiovascular system in animals If it's good to actually have someone in veterinary medicine to have this specialty on animal cardiology so we can actually understand better Okay, so alright, do you have the start of cardiovascular drug? Again, it's actually divided into the effects these drugs have on the heart Okay, we have drugs actually that acts on the contractions of the muscles. Okay, also at the drugs that actually acts on the impulse, of the sinoatrial node, and also the induction of the electrical impulses Okay, this actually category is normally used for drugs that is used for humans Okay. Seldom we use or we don't use at all like positive phonotropic drugs, and also this negative chronotropic, and also positive chromotropic, and also the negative chromotropic drugs in animals. Why? Okay, because the study itself, the cardiovascular in animals, because we don't have that extensive study. Even a echocardiogram on animal is not that properly documented. So why bother using this drug if you don't not sure what is it going to work in animals? Okay, that's why the one that is actually commonly used is only the drug that actually affects the muscular contraction. Okay, that's why only the positive inotropic drugs and also the negative inotropic drug is actually used. Sorry, actually the negative inotropic drug also is not used at large lah, in animals. Okay, only the positive inotropes, okay, that is used. Okay, normally we don't really use the negative inotropic drugs to reduce, okay, the decrease the force of nitrogen production. Only if the animal is having, low, a muscle is not moving, or maybe the muscle is moving slowly. Okay, that's why they use the positive inotropic drugs. Okay. So there are two groups of drug that is used as a positive inotropes. Okay, we have the cardiac glycosides. Okay, example is actually digoxin and digitoxin. All right, so it increases the strength of cardiac contraction. Okay, increase the heart rate. It's not decrease there. It's increase. It's increased heart rate. Okay, and also have an anti-arrhythmic effects, okay, and decrease signs of dyspnea. Okay, that's the positive inotropic, which is the digoxin and also the digitoxin. Okay, how does digoxin work? Is actually by making more calcium available. Okay, it actually utilize calcium available for the contractile elements within the cardiac muscle cells. Okay, they make more of the calcium available. It's not that the drug itself works on the heart. It actually makes the more calcium available. Okay, so when calcium available, it actually will make the cardiac muscle to be more contractile. Okay, all right. Second is actually okay, and also digoxin and the cardiac glycoside, they have a much more longer long-term effects lah. So meaning that the dose can be given once, and then you can monitor, probably another dose can be given after maybe 3 or 4 days lah. Okay, because they have a long-term effect lah. Actually to manage the condition where patients have a chronic myocardial infarctions, for example. So this is the drug to manage lah. Okay, if you see any of this drama or whatever, right? So you see that people having heart attack, they have like a pill. You say kochi, meaning that the drug is inside this pocket lah, so to give lah. But actually the one that inside the drama or whatever is actually, I mean, is quite dramatic lah, because you see once they someone is oral, give the pill actually given orally, suddenly after like 10 seconds they're okay already. Actually the drug takes maybe like 10 minutes or 20, it depends lah. Okay, the action might take longer than actually 30 seconds lah. So the one in the TV is always dramatic ones lah. Okay, so another positive inotrope is actually the catecholamines. Okay, alright, the catecholamine increase the force and heart rate of myocardial infarction, they constrict the peripheral blood vessels and increase blood glucose levels. Okay, we have epinephrines, dopamine, dopamine, and also isoprotenolol. So I've already touched about this on epinephrine. What does catecholamine do? Actually will stimulate the beta-1 receptors in the cardiac muscles. Okay, and by that it will improve the contractility of a weakened heart for a short periods only. Right. So given this, the duration of effect is quite short. Okay, this is actually using only for emergency aid lah. Let's say if the heart starts stops moving, stops contracting, so you give this catecholamine, so for short term lah. Because what if it's given if you given in repeated dose, all right, the cell will actually becomes immune to this drug. Okay, they will actually become lesser and lesser to response to stimuli. Okay, that's why it is not given for a long term effect. If you give for a long term, you use the cardiac glycosides, which is the glucose and also the digitoxin. Okay, that was for the positive response lah. All right. So the next action a cardiovascular drug does actually used as an anti-arrhythmic drug lah. Okay, arrhythmia meaning that there is an irregular beats of the hearts lah. So anti-arrhythmic drug is actually used to correct the variation in the normal beating of the heart lah. Okay, if your heart is not beating properly, it will actually leads to reduced cardiac output lah. Okay, so there are types of anti-arrhythmic drugs. They can be divided into 1, 2, 3, 4, 5 classes of drugs lah. Okay, examples of this anti-arrhythmic drug is in table 1. So, you see or not? Okay, I besar sikit. Oh, sangat. Maybe go 35%. Okay, so we have like class. They have like 5 class. We have class 1A, class 1B, class 2.
Doktor.
Yeah,
Tak nampak ke?
tak nampak? Anybody else yang tak nampak?
Tak nampak doktor.
Tak nampak sekejap ya. Okay, okay, can you see?
Yes.
Okay,
Yeah.
so we have anti-arrhythmic drugs. Okay, we have class 1A, we have class 1B, we have class 2, we have how to go up. Okay, all right. We have class 2, class 3, and class 4. Okay, we have this class lah. Okay, how does actually how they give them classes is actually based on the action they have lah. Okay, so for example, class 1A, the drugs that belongs under local anesthetic, they can also be used as an anti-arrhythmic drugs. Okay, they work as a local anesthetic and also increase conduction times to the nerves and myocardial membrane. Okay, we have 2 drugs, which is the quinidine and also the procainamide. Okay, they are all considered as local anesthetic and also they are used as a anti-arrhythmic drugs lah. Okay, so next is actually the class 1B, which is the membrane stabilization. Okay, this group works by blocking the influx of the sodium into the cell, thus stabilizing the myocardium and preventing depolarization lah. Okay, if depolarization occurs, meaning that all the the drugs actually lost is actually the charges become depolarized, so the conduction time, also the electrical impulses in the heart will actually be disrupted lah. Okay, all right. If a patient usually undergoes maybe bypass or maybe a heart transplant, okay, they actually if the drug itself cannot be given in long term, they actually place a pacemaker in the heart, pacemaker. So they will actually prevent depolarization and also to control the electrical impulses in the heart. Okay, some people call it battery. Actually not the battery, it's actually a pacemaker lah. Okay, all right. Next is actually the beta adrenergic blockers. It's the class 2. Okay, this one is actually I've touched this before during the peripheral nervous system drugs. Okay, works by blocking beta adrenergic receptors or preventing release of norepinephrine from the adrenergic neurons. Okay, it will actually used to treat hypertrophic cardiomyopathy and some ventricular arrhythmias lah. Okay, next we have the how to go down. Okay, then we have class 3, which is the action potential prolongation. Okay, the work with the lightning dynamic itself is actually saying that the action potentials lah. Okay, so they increase the duration of action potential. Okay, so they are given to treat ventricular tachycardia and also fibrillation. Okay, fibrillation is meaning the heart is actually not moving lah, fibrillation. So the name of the machine is actually a defibrillator. Okay, defibrillator is actually to treat, or to remove fibrillation, right? So we have breathilium is one of the. I don't think that action potential prolongation is actually common lah, used lah in animals lah, because we don't really encounter the use of this like breathilium in animals lah. Okay, that's why humans actually pick us lah. We design a lot of this exciting cardiovascular drugs lah. But the thing is, it's actually a waste because we cannot try on animals because the study itself is not really that extensive. Nobody actually wanted to venture this. We have a lot of these cardiologists lah. Okay, it's different. Cardiologist surgeon and also cardiologist is two different thing lah. Okay, cardiosurgeon no problem. Actually, we have a lot of people actually can do cardiosurgery, but cardiologist study of this, how to treat drugs, how to treat heart problem without actually any invasive like the use of surgery and stuff like. That's the waste lah. Sayang lah because we don't have that. Drug is available for humans. A lot of study because how extensive we have our own Jantung Negara, National Heart Institute to study, doing research, treatment, and everything. But animals we don't have. Okay, it's just something that I can throw a challenge to you guys lah later on when you graduate. Start to go study on the veterinary cardiologist lah. Veterinary cardiologist lah. Cardiology. Okay, sayang because the drug we have a lot but we don't use. Okay, and the last group is actually the calcium channel blockers. Okay, grouped by blocking channels that allow calcium to enter the myocardial cells. Okay, so the entry of calcium into the cell facilitate, the muscles contractility. We have the nifedipine and also the diltiazem. Okay, again, we don't see later on when you go. I don't know whether you guys have the chance to come to the university okay, after 31st December because we have the practical on actually visiting the pharmacy. I can actually explain how drug, you can actually really relate if you study in the classroom or even online, something that actually you can really touch. For example, you say diazepam, whatever, right? You just imagine if you can touch, the bottle and actually appreciate the weather. I hope that, I don't know, Nimalan, when is the practical on the pharmacy? I think it's after January. If it's January, you guys can come over to the faculty, then it will be great lah. We can actually, if not, I have to do a virtual class lah at the pharmacy and show you lah. Okay. Again, something when you experience on live different when you see on TV or whatever you see on the screen lah. Okay. Alright. So stop sharing. Go back to the slides. Okay. Alright, another drug, okay. Action they have on the cardiovascular is actually a vasodilators. Okay, vasodilators is actually drugs used to dilate arteries and veins, which alleviates venous constriction and improve cardiac output. Okay, we have 1, 2, 3, 4 types of drug that can be used as a vasodilators lah. We have the angiotensin converting enzyme inhibitors. Okay, example of this drug is actually enalapril. The spelling is ENALAPRIL, enalapril. All right. Okay. Okay, how does this angiotensin converting enzyme inhibitors or ACE inhibitors, people call it as ACE inhibitors. Then next time if you see the word ACE inhibitor is actually a drug. Okay, this vasodilators lah. Okay. They actually it affects both the artery and also the venous. Okay. Alright, by blocking the angiotensin converting enzyme, the name itself, okay, and preventing formations of angiotensin 2 lah. Okay, angiotensin 2 is actually a very potent vasoconstrictor, right? And also aldosterone lah. Okay, effects on the atrial and venous vessels by blocking the AC enzyme and preventing formations of angiotensin 2, okay, which is a potent vasoconstrictor, and also aldosterone lah. Alright, so by this they will actually dilate or vasodilation lah. That's the vasodilation will occur lah. So improve more cardiac output lah. Okay, that's the function of ACE inhibitors lah, like enalapril. Second, actually, arterial vasodilators. Okay, the name itself actually refers to the thing that it does, which is to dilate the arteries. Okay, the example is hydralazine. It's HY. Okay, like the spelling Hydra and Avengers tu kan. HYDRA, Hydra. Lazine, LAZINE. That is the spelling for atrial dilator, which is the hydralazine lah. Okay, alright. It directly causes arteriolar smooth muscles, okay, to relax. Okay, relax will make it can expand or dilate. Okay, through inhibitions of calcium movement lah. Through inhibitions of calcium movement within the smooth muscle cells lah. Alright, cause arteriolar smooth muscles to relax through inhibitions of calcium movement within smooth muscle cells lah. Alright. If the drug is nearly given to patients with a poorly functioning left mitral valve. Okay. Normally used in animals with poorly functioning left mitral valve. Okay, if the mitral valve is not working, okay, they use this drug to reduce, to increase the functions of the left mitral valve. Alright. Next is actually the vasodilators. Now, the name itself actually refers to the name to actually dilate the vein. Okay. Alright, they will actually use to relax the blood vessels on the venous sides of the circulation. Let's say if you want to dilate only the venous. For example, if you have the venous system actually pulls the blood from the area around the body back to the heart. Okay. Like example, if you have a poor venous circulation, you use these vasodilators, okay, to restore the circulation back to normal . Example of vasodilator is actually nitroglycerin. You know nitroglycerin yang buat bom tu, the one that we use to make bomb nitroglycerin. Okay, but this one also be used as a vasodilators. Nitroglycerin, nitro and ITRO, glycerin, GLYCERIN. Okay, they are nitroglycerin. Okay, so if you want to use this drug, make sure keep it properly, alright, away from source of heat, away from the source of fire. Okay, if not, they will actually explode. Okay, because they are actually used as a compound in explosives nitroglycerin. Okay, tahu tak C4 tak? C4 used to be very famous kan dulu kan, involving a very prominent Mongolian beauty. Tapi I don't want to actually elaborate more it is C4 nitroglycerin. Okay. Next we have the combined vasodilators. Okay. Combined vasodilator is actually the drug that can be used to both to dilate the vein and also the arteries. Alright. The example of combined vasodilator is prazosin, PRAZOSIN. Prazosin, okay, is an alpha-1 receptor blocker. Okay, it causes vasodilations on the atrial and venous side of the vascular system. Okay. Normally they use prazosin for animals with CHF, congestive heart failure. Okay, especially when the failure is associated with poor mitral and aortic valve function. Okay, especially in animals with failure associated with poor mitral valve or aortic valve function, or in animals that then responsive to other vasodilator medication. If the animal is not responsive probably they are allergic to other vasodilators, okay, you can use Pyroxene lah. Right. Okay. Alright, any question on the vasodilators? Okay, next is actually the anticoagulants. Okay, this doesn't actually directly affect the cardiovascular system. It actually, the tissues only affect the system that actually works on the cardiovascular system lah. Okay, like this case anticoagulant more towards the hematopoietic system kan, tapi directly they actually involved in the CVS juga lah. Okay, anticoagulant is actually to inhibit clot formation by inactivating one or more clotting factors lah. Okay, used to inhibit clotting in catheters, to prevent blood samples from clotting, to preserve blood, okay, to preserve blood sample from blood transfusion, and also to treat emboli. You know what's emboli? Emboli kan? Okay, gas or gas bubble lah inside the arteries or in the veins lah in the circulation. Okay, example of anticoagulant is heparin. Okay, heparin, you know, blood tubes, okay, to prevent, if you want to collect the plasma from the, or serum from the blood, okay, you need, the blood cannot be, clot the blood. So use heparin lah. Okay, in heparin, blood tube, what color is the lid is what color? Red, right? Okay, red. Okay, there are three types of, red, oh, sorry, green. Sorry, green. Green is for heparin. Okay, just remember later on when you go for your FYP, you're going to take blood, let's say you want to samples need to be in plasma. So you need to know which one is you want to choose lah. We have three colors. We have the red, which is the plain blood tube, is actually for the blood to clot, so you can actually collect the serum. Okay, and also EDTA and heparin. Okay, heparin is yellow, is green. The tube is green in color, not the tube lah. The stopper lah. Okay, is the rubber stopper lah is actually green, and the tube for EDTA is in purple lah. Okay, all right. So if you want to use, if you want to do complete blood count or maybe whole blood count, okay, you use heparin or EDTA. Okay, if you want to mix plasma, also use for heparin EDTA. But for if you want to use serum, you use the you use the plain tube lah. Okay, also coumarin derivative, aspirin, and also blood transfusion anticoagulants. Okay, anticoagulants in heart is actually used exclusively for post-treatment of heartworm prevention lah. Okay, heartworm treatment. Okay, you know what heartworm? Dilophilaria immitis. No kan? Dah belajar belum? Parasite, heartworm.
Yes, doctor.
Okay, so heartworm is it Dilophilaria ke? Heartworm. I'm not a parasitology, I can't remember. I think Dilophilaria kan?
Yes.
Okay, Dilophilaria immitis. Okay. When they use this ivermectin, for example, heart guard, okay, they're given orally to dogs with heartworm, let's say. You imagine, it's like just like a war zone inside the heart, where you have all these dead worms, and also we have all these waste product from the dead worms, and also all these inflammatory cells going there. They have like a war zone there. So tendency for clotting or blockage occurs in the heart is very high. That's why if animal is after undergoing treatment for heartworm, they will given aspirin, especially aspirin lah, in order to reduce the clot formation and to clear off any blockage in the heart, and also to remove all these dead soldiers and also dead enemies. Okay, and the enemy meaning that the worms lah. Dead soldiers is actually our inflammatory cells lah. Okay, from the heart. Alright, that's the function lah for anticoagulants lah. Other than that, maybe if an animal is having allergic reactions towards something, okay, and then a lot of these debris lah, okay, and then this will attract a lot of these inflammatory cells, okay, in the histamine, for example, histamine debris everywhere. So you give this actually to remove all these dead cells and also inflammatory cells from the area. So you use also anticoagulants lah. Okay, right. Have hemostatic drug. okay, is the opposite of anticoagulant. Okay, actually they help to promote the clotting of blood. Okay, so it's actually given either parenteral or topical. Okay, parenteral is actually a vitamin K. It's not a drug, it's a vitamin, and also protein sulfate lah. And parenteral meaning that it's given either through IV, subcut, or also IM. And topical is actually given on the probably on the for example, we have an open wound, okay, and there's actually bleeding over there. Okay, if animal is bleeding, okay, they have actually have a hypervolemic shock. Actually, will affect the heart. The heart actually have to pump much more faster, right? So because there's lack of blood to be distributed, okay, onto throughout the body. Okay, because there's lots of blood. For example, you have the animal lost blood from the wound on the left, fracture wound, for example, on the left femur. Okay, the heart actually have to pump the blood higher because they want actually to give the blood to other side of the body. Okay, maybe the right leg, the brain and stuff like that. So if the heart, if an animal, for example, or human today having a very chronic heart problem, okay, bleeding can actually cause the animal or human died not from the bleeding itself, sometimes from the cardiac attack or heart attack. Okay, because of the failure of the heart to actually to pump the blood properly. Okay, that's why. Okay, that's why we use the hemostatic drug. It doesn't directly work on the heart, but actually indirectly actually affect the heart if it's not attended properly lah. Okay, alright. That's why if somebody is having a heart a clotting problem, okay, one of the things they actually look for actually the clotting factors, okay, like prothrombin and all the stuff. Until later on, you actually start studying CP belum, clinical path. This time or next semester? Clinical pathology. Next sem, right? Okay, next semester you will learn on clinical pathology. Okay, they will actually learn more about all these clotting factors, prothrombin, PTT, prothrombin clotting time, all these tests that actually you can use to see where to determine whether the animal is having clotting problem or not. Okay. All right. Next is actually the blood enhancing drugs. Okay. Right. It's actually used to affect the RBCs. Okay. Again, if blood is actually in high quality, meaning that everything is in actually normal order lah. RBC, RBC count, white blood cell count, all those that must be. Okay, so blood enhancing drug is used to actually affect the RBCs, the production, also the quality lah. The example of not say drug lah, example of sub compound that we use to affect or to enhance the blood formation or production or quality is actually iron. Okay, have you guys went to your swine practical lah? Dah pergi lah swine practical? Sempat tak pergi?
Patutnya last semester, tapi because of
Okay. No, if you go for swine practical, you can actually, one of the practice is actually, one of the common problem we have with piglets is iron deficiency anemia. Iron deficiency anemia because iron is part of the part of item or compound we use as to produce hemoglobin kan. So one of the piglets problem is common. Okay, we have essentially iron deficiency anemia. And later on, if you go to a swine farm, you see newly born piglets. One of the practices actually other than cutting the tail, so removing the teeth, apa nama dia punya gigi tu, the taring lah, the fang, something like that, I can't remember. And then also one of them to give injections of iron deficiency okay, you four. They have to four practice. First, actually cutting the tail. Second, actually to castrate. Castrate is actually to remove the bottle lah. The bottle later on when unless if the piglet bore is used for production lah as a breeder, then you have to remove the it is okay. The bottling is actually to prevent if the piglet becomes big later on, the bore actually cause it will have like a distinct smell, something like that. It doesn't actually, it will put off the consumers lah. Okay. Castration, removing the tail, removing the milking teeth. I mean, because the milking teeth is quite sharp. Later on, when you suckle the meat, the teeth from the mother actually will actually injure the sow lah. Okay, the milking sow lah. So another one is actually to give iron lah, to prevent from iron deficiency anemia lah. Anemia is actually term used for lack of RBC in your blood lah. That's what anemia lah. Okay, another one is actually to give erythropoietin lah. On a short, some people, if you heard of the word EPO. Okay, EPO is actually a substance used also, but EPO is actually banned in sports. Okay, anybody nowadays you see a lot of people like cycling, and anywhere you go a lot of people cycling. Because something to do relate cycling because of Lance Armstrong. Now Lance Armstrong, a disgraced 6 times Le Tour de France champion lah. Okay, Lance Armstrong actually for the past 6 times he won the Le Tour de France actually by using EPO. So he is banned lah. Okay, on all the prize actually being taken away from him lah because the use of EPO lah. Okay, alright. EPO actually is a hormone lah. Right, the hormone responsible for inducing RBC production by the bone marrow lah. Okay. Alright. Another thing that is if you want to also increase your RBC formation in naturally, it's actually by living in an area where it is very very high from the sea level lah. Okay. The La Paz, Bolivia, La Paz, the town called La Paz. La Paz is actually the capital city of Bolivia. It is the highest point from the sea in the world, if I'm not mistaken. Sorry, not the world because the world we have mountains, Everest, okay, everything. Meaning that land area, the highest land area from the sea level. So people over there, they actually tend to, because the oxygen is thin. Okay, so the people over there, they actually quite resistant or immune, meaning that their body itself produce a lot of these blood RBCs from the bone marrow because to transport the lack of oxygen they have inside the area. Okay, people normally one of the complaint they have actually footballers lah. Okay, footballers, if they have to play Bolivia in La Paz, they actually complain because they tend to actually becomes more and more lethargic easily. Second is that they actually becomes more drowsy and also very tired because when they play football and then the lack of oxygen over there. So the body need to actually generate more RBCs. Okay, that's why they becomes much more lethargic lah. Okay, that's actually quite an advantage to the team lah. If they play, for example, Brazil or Argentina in La Paz, usually they will win lah. Okay. That's why if you want to play football over there, they have to go back that bit, maybe 2 weeks earlier to acclimatize themselves with the environment before playing. Okay. All right. Any questions? Cardiovascular system. Do you still have time? You want us to continue with urinary? If not, we can continue tomorrow. Okay, we continue tomorrow. Urinary pun quite banyak juga ni. Okay. So never mind, we can continue tomorrow for the urinary drugs. Okay, for cardiovascular, any questions? Tomorrow 10 pagi AM Okay, if no questions, thank you very much. Okay, I'll see you guys tomorrow. Okay, bye.
Thank you, Doctor.
Thank you, Doctor.
Thank you, Doctor.
Thank you.
Doctor.